I conducted a systematic review on the effects of sensory integration therapy on children with attention deficit hyperactivity disorder, or ADHD. ADHD is one of the most commonly diagnosed chronic behavioral diseases in children and is characterized by inattentiveness, distractibility, lack of certain social skills, and impulsive movements or fidgeting. These symptoms can negatively affect a child's life. So in many cases, ADHD is treated with medication. These medications, while lessening the symptoms of ADHD and improving the child's attention and focus, can have adverse side effects. However, a form of therapy known as sensory integration therapy has been shown to alleviate symptoms of ADHD in children without causing any of the adverse side effects that medications could produce. Sensory integration therapy is a form of therapy used by occupational therapists that focuses on exposing the patient to structured, repetitive sensory stimuli so that the patient will eventually be able to process and react to sensations more effectively. Occupational therapists will use weighted vests or blankets, stability balls, and other various mediums to expose the patient to a variety of sensory experiences. When I was researching for this systematic review, I focused specifically on articles that mentioned the exact mediums that were used for the therapy, such as weighted vests, weighted blankets, compression vests, etc. I started with 17 articles, and after going through the inclusion and exclusion criteria, which can be seen in Figure 1, I ended up with 8 articles. Of the 8 studies, 6 showed a significant improvement of ADHD symptoms in children after they participated in various forms of sensory integration therapy, which is shown in Table 1. And this evidence suggests that using sensory integration therapy as a treatment for children with ADHD is associated with an improvement in behavior, attentiveness, and social skills. Researchers found that the constant stimuli provided by the weighted vests, weighted blankets, stability balls, etc., helped the children to block out other distracting stimuli, and the children were better able to complete a certain task and socialize with their peers and teachers. Based on the evidence from this systematic review showing mostly positive outcomes from this therapy, practitioners should consider implementing sensory integration therapy into treatment plans for children with ADHD.